So I'm Dr. Natalie Abramson, pediatric psychologist at Children's Hospital Colorado. You should pay attention to any signs of reluctance to go to school or even overt refusal to go to school. Those would all be meaningful as suggesting that perhaps something is going on that you need to be aware of. So whether they're just simply, I'm not going to school today, or if it's more subtle, like I have a stomach ache, I have a headache, I don't think I'm well enough to go to school, or any other activity, that would be something to look more into. I think there are probably three things. The first would be making sure that your child understands that he or she can come talk to you about anything, and no matter how insignificant or how significant, they should feel like their parent is there to hear them out and to listen, not necessarily always to talk back, but just to listen and hear them. Secondly, I would suggest having a bit of a network of relationships, not just between your child's peer group, but also among the parents of your child's peers, so that there's some lines of communication between other moms and dads within that peer group, so you guys can kind of, over the top, keep tabs on what might be going on within that circle of friends. And then the third thing would be to keep very open lines of communication going with the school personnel and being able to understand what's going on, be it their homeroom teacher, their soccer coach, their guidance counselor, making sure that you're asking the kinds of questions on how they're doing, not just academically, but also socially and emotionally. For more information on tips on how to deal with bullying and ideas for parents, visit childrenscolorado.org.